WBUR Podcast, Boston.
I'm Darryl C. Murphy, and you're listening to The Common. Today, we have WBUR senior health reporter Priyanka Dayal McCluskey. She's here to give us a post-holiday COVID update and help us understand where things are with the pandemic overall. So, Priyanka, first, thank you so much for being here. How are you doing?
I'm doing pretty well, Darryl. How are you?
I'm all right. I'm looking forward to this conversation because it's still real out here. So let's get right into it. What's going on with COVID at the moment? You know, what's up with the numbers? What are the cases looking like? What are you seeing out here?
So COVID is increasing again. We've seen a sharp increase in the wastewater data over the past several days and weeks. And we see more cases as well as more hospitalizations over the last several days and weeks. So it looks like we're in another upswing.
And what's driving this particular upswing?
So many of us traveled or spent more time with friends and family over the December holidays, and that's certainly a likely factor. And we've seen that the last couple of winters as well, that when we go indoors and gather with more people, viruses can spread.
Mm-hmm.
But there's another factor too, and that's a new variant called XBB 1.5. And that has been increasing really sharply in recent days. And the CDC estimates that it actually accounts for about 75% of cases in New England right now. So we are seeing that variant really grow quickly.
Oh, wow. And when you talk about a new variant, around this time of year, I'm thinking about last year where there was the Omicron variant, which seemed to shut everything down for a time, Can you just speak to how this year compares to where we were last year?
Yeah, I think that's really important context. So last year, the Omicron variant was pretty new at this time, and it was really taking off, and the number of cases and hospitalizations really skyrocketed around this time last year. So this year, in comparison, we're seeing an increase, but not at the same level as last winter.
Mm-hmm. So we're not in quite as rough of a situation as we were this time last year. But I do understand that hospitalizations are still up. Tell me about that.
Yeah, so the number of COVID patients in hospitals across the state has increased. It's actually about doubled in the past month. But some more important context there. Most patients who are COVID positive and in the hospital, they're being treated for something other than COVID. COVID is an additional diagnosis that they have, but it's not the main reason that brought them to the hospital.
Okay. And, there was also some talk of a triple-demic, the flu, RSV, and COVID. Where are things with that situation?
Well, we have seen all three of these viruses circulating a lot in recent weeks, so it's already been a pretty rough winter. As you and I talked about previously, there was a really big surge in RSV back in October, November. That seems to be in a better place now.
That's good.
And flu also really took off in December, and we're still seeing high flu numbers, but are hopefully past the peak of that, according to the doctors that I've spoken with.
We're going to take a quick break, but we will be right back with more from Priyanka.
Did you kill Marlene Johnson?
I think you're one of the first people to have actually asked.
From WBUR and ZSP Media, this is Beyond All Repair, a new podcast about an unsolved murder that will leave you questioning everything.
Somebody should be in jail for murdering my sister.
A woman who's never been believed.
As long as they think I have done this, then they're not looking for who actually did this.
And that's what makes it a cold case.
No, it's a botched case.
And a search for the truth, once and for all.
Wow, it just gets more interesting.
Beyond All Repair. Listen and follow wherever you get your podcasts.
Be careful. You're digging in a place that's been very peaceful for a while.
Do it anyway. Dig.
And we're back. So, Priyanka, you spend a lot of time talking with doctors and other medical staff, especially when considering this uptick in hospital numbers. What are you hearing from the people who are on the ground doing the work?
So the people on the ground doing the work are pretty tired from several years now of fighting the pandemic and everything else that they have to do. One thing that's really changed is COVID is no longer the main stressor on the healthcare system. It's one of many now. So there's other respiratory viruses circulating. People are getting sick with all kinds of other diseases, needed surgery, need treatment for various medical conditions. And so the hospitals and the healthcare system are seeing all of this, and they are having a hard time keeping up with demand sometimes.
Well, it's been a little bit over 3 years now. We are still in the midst of this pandemic. And, we've evolved a lot since the beginning. And things are mostly back to normal for a lot of people, with all due respect to those who are immunocompromised and have other conditions and things. But how can people protect themselves, as we move on into this pandemic?
Yeah, so it's a lot of the advice that we've been hearing for a while now. There's always the mask that you can wear especially in crowded indoor spaces that could help protect yourself and others from spreading COVID or other viruses. And public health experts are really still stressing the importance of vaccination and staying up to date on booster shots. And not everyone has gotten their booster shot. I mean, our level of vaccination is relatively high in Massachusetts, but not everyone's getting their booster shots. So that's another step that public health experts say you can take.
And how about yourself? I mean, how have you been moving through the pandemic? What's changed or stayed the same for you?
Yeah, well, like a lot of people, I think my behaviors today are not exactly the same as they were a year ago or 2 years ago. We're trying to live a little bit more normally, but we're in this phrase that we're all sick of now, the new normal, right?
Yep.
So, that means always having a mask nearby and sort of assessing.
I stay with that KN95 all the time. I stay with it.
Yes, and just assessing your own level of risk depending on if you have any health conditions or if you have people in your family, younger or older, who you're trying to protect. So on Christmas Eve, I actually had a cold, and I knew it wasn't COVID because I had taken a couple of tests, but I decided to wear a mask around my family just to kind of take that extra step, which I don't think I would have thought of a couple of years ago, but now it's just something that we always have masks handy and can take them out when it makes sense to do so.
Priyanka, thank you so much for coming through and talking to us and helping us understand what's going on because, it's still real out here. So thank you.
Thank you, Daryl.
That's WBUR senior health reporter Priyanka Dayal McCluskey. One more thing before we go. You typically get your local news fix in the morning with us at The Common. But what about the national stories? Well, you can get those in the afternoon with the new podcast from WBUR and NPR called Here and Now Anytime, hosted by Chris Bentley, who is here with us now. Chris, congratulations on the show.
Thanks. Hey, Daryl.
Hey, so some of our listeners may be familiar with the Here and Now radio program, but tell us about this new podcast version.
Yeah. All right. So Here and Now Anytime comes out every weekday afternoon, and we try to give you the news that you need to know today and something maybe you didn't expect to hear about, but that will stick with you tomorrow.
Okay.
So, yeah, that's it in a nutshell.
Give me an example of a story that I'll hear on Here and Now Anytime.
You'll definitely hear the news, like right off the bat. You'll probably hear something about kind of the big story of the day. And you're going to hear it in the afternoon, which is when seems like all the news is breaking these days, between noon and 4 Eastern, when we're kind of on watch. I'm thinking of President Biden's recent immigration announcement, his executive orders overhauling a lot of the protocols about who can claim asylum and how. We had on an NPR reporter and immigration experts to talk about that recently. But then, we'll also take a step back and talk to people who are affected by the news. We just had a conversation with one man who was reunited with his family in California after returning to the U.S. from the Philippines, where he was deported to because of a criminal conviction that was later overturned. So he was wrongfully convicted, but he wasn't able to get his deportation overturned for 20 years. And we talked to him about how he did that and what it was like that whole time. And it sort of got at the immigration story in a different, more personal way, in addition to sort of getting the big picture.
So, Chris, I got to tell you, I listened to that episode myself, and I think I'm going to have to add Here and Now Anytime to my rotation. I'm thinking of it as the Common's older sibling who reads a lot of books and has a PhD.
Guilty as charged, I guess, unless I don't have a PhD, but I do read some books, so I'll take it. Thank you.
Oh, yeah. Thank you so much for sharing your time with us.
Thanks, Daryl. Thanks for having me.
Check out Here and Now Anytime wherever you get podcasts. And that's our show for today. Thank you so much for listening to The Common. Please make sure to hit us up on Instagram or Twitter at WBUR The Common, or send us an email at thecommon@wbur.org. I'm Daryl C. Murphy, and I'll talk to you tomorrow.